Okay, and we are back, and this time we're going to talk about cognitive behavioral therapy. So CBT, kind of. I know I mentioned it in the last chapter because it's related to behavior, but this has more of a cognitive approach. So to me, the biggest difference between the behavioral and the CBTs is the behavioral looks at the concrete, the action, the visible. The CBT really combines the two. Um, and the big guru of this was Aaron Temkin Beck, who was born in 1921. And he is a professor still at the University of Pennsylvania at their Department of Psychiatry. He is kind of the founder of cognitive therapy. And what really made him a name in the field was his inventories. So, we even refer to it by the acronym the BDI, so the Beck Depression Inventory, which is the most widely used inventory in the field to measure depression and the severity. So, as a behavioral therapist or a CBT therapist, if somebody came to me and mentioned hopelessness, low affect, low motivation, one of the first things I would do is talk to them about this inventory, the BDI, and let them know that, I want to measure the severity of it. Because as we go through therapy, part of the therapist's goal is, if it's really high, a 25. I believe 30 and up is kind of suicidal. So if they're at a 25 and by the eighth session, I expect that, or, we can talk about our goals and to try to decrease that. So I'm trying to think back to the clients that I had. A teenager, I can remember he started off as 25. By the eighth session, I believe he was at 8 or 5. So, um, really widely used. A lot of publications. Beck, when you go to a bookstore, I'm sure you can find he had over 600, or he has over 600 journal articles, 25 books. Um, really, really kind of a guru of the field. And he actually has the institute, which is part of the University of Pennsylvania, where he trains clinicians on his cognitive approach. So really big, very, very research based. And some of the other inventories that are very common with cognitive behavioral are, I know I mentioned the Beck Depression Inventory, the Beck Hopelessness Scale, the Beck Scale of Suicide Ideation, the Beck Anxiety Inventory, the Beck Youth Inventory, and the Children's Depression Inventory. So a lot of those are widely used in the fields, and even now he's kind of training and refining his model. Another person just to mention is Martin Seligman, who did the experiments of the dog that he shocked to the point where the dog just kind of gave up and just kind of laid on the floor, and he termed the what we call learned helplessness, and that deals with people that are depressed. They're just so overwhelmed that, similar to a dog, they get shocked, and they keep getting shocked. They keep getting shocked to the point where they just kind of give up and they just kind of lay on the floor because they see no exit. They see no way of getting out. So they basically just, lay there and stay overwhelmed. And that's kind of that negative feedback loop that a lot of people with depression have a tendency of having. The previous video, we talked about the ABC model, antecedent behavior consequence. I'll mention that again because that's really important. Also, cognitive therapy talks about um, kind of the miss ways of thinking. So the seeing things in black and white, which means either they're really good or they're really bad. There's nothing in it. There's no gray, and that can be a problem because if you see that, um, it's possible you don't give maybe somebody the benefit of the doubt. Maybe you're not willing to look at the whole person. So that's part of some of the cognitive errors that are very common. Another one, arbitrary inference. So just arbitrarily making a conclusion of somebody without really having any data to back it up. And that's part of automatic thought, which is kind of a maladaptive way of thinking. That again, cognitive behavioral. So we're looking at the cognition, and we're also looking at the behavior. So we're looking at how the cognitive impacts the behavior, which is different than B.F. Skinner's behaviorists, because they're just looking at the behavior, the environment, the reinforcers, the consequence. So that's kind of the main difference when we talk about behavioral versus cognitive. So cognitive is really looking at the two. So whereas a behaviorist would do a behavior modification, just looking at the environment, a CBT therapist would look at kind of the cognitive approach. So looking at the core beliefs, looking at kind of the irrational, a phrase they use a lot is stinking thinking, the cognitive distortions. So when we talk about cognitive distortions, we're talking about things like coming up with the inference without data, selecting things very abstractly. Like if I see a person and they're wearing maybe a shirt I don't like, then my perception is, oh, I don't like that shirt, so I'm not going to like that whole person. Overgeneralizing, so just making statements, oh, if blank person did this, then they all must be bad. Magnification or minimization, so sometimes we exaggerate, sometimes we do the opposite. We minimize things. A lot of times we mislabel. Based on our perception, we come to a different conclusion. And dichotomous thinking, talked about that earlier, that black and white. It's either really good or it's really bad. Either my life is going as well as it can be, or I am super depressed. And personalization, that's a big one, especially with kids. They think that they have an audience, and they look at you and, oh, they're thinking this. Well, what makes you think that they're thinking this? Did you ask them? Were you able to verbalize? Oh no, but just the way they looked at me. I already know what they're thinking. So, as a school counselor, I actually have a chart of all these behavioral distortions, and I talk about them a lot because I think they're important for kids to know. Because even adults, we do this a lot, and if we're not cognizant, if we kind of let that cognitive distortion become an automatic thought, then that can influence our behavior and our perception of the world. So again, behavioralists study the visible, the behavior, cognitive behavior therapies. They talk more about the thinking, the cognition, the cognitive distortions, and how that impacts behavior. So Aaron Beck, big guru. If you're looking at doing assessments, inventories, all that, you have to learn about Aaron Beck. He's kind of the pioneer of that work. Um, so when we talk about cognitive restructuring, we're talking about looking at these cognitive distortions and then working with the client to work through these maladaptive thoughts and then replacing them with more of a actual belief. So again, their world, they're looking at things very differently. And what the cognitive behavior therapist is helping them, they're helping them see things through a different lens, which is a more rational, more um, actual evidence-based lens. So um, make sure you're aware of that. Make sure you're aware of the cognitive distortions. Um, and with CBT, um, similar to the behaviorist, it's real popular because it has a lot of empiricism. So if we can't back things up with data, then Aaron Beck and others would tell you you're not supposed to do this. So a lot of their theory is based on things that are empirical. So similar to B.F. Skinner, data driven. And that's why they're used a lot in the schools. That's why they're used a lot in institutions, because um, they have a lot of research to back it up. And similar to behavioral, CBTs use a lot of homework. So you have a very active therapist, engaging the client, really looking at cognitive distortions, talking to the client, having an internal dialogue, telling them, oh, what's inside your mind, what is your mind telling you, and then really looking at that and making sure that the client sees how irrational it is, and then um, modifying that so that the client is able to see things through a different lens. So again, we talked about the cognitive distortions, uh, the what was it? Albert Ellis. He's a kind of a big CBT guy. He coined the term masturbation, which is the must. You should, you ought, you must do this. And he labeled that the irrational thinking. When we talk about Ellis with Gloria, he's kind of confronting her. This is a must. You have to do this. And part of a CBT is to look at all that, to look at the distortions, the irrational behaviors, and then to create a new lens that is more adaptable for the client. So be sure you know about the core beliefs. CBT therapists, they talk a lot about the core beliefs, and somebody that is suffering from depression, anxiety, a lot of times their core beliefs are negative. I'm not worthy of love. I'm not a good person. I deserve to suffer. So part of that schema is to look at that dysfunction and then go about and modifying that. And that's really common, when we talk about people that suffer from mental illness. Um, it didn't happen overnight. A depressed individual, it didn't isn't depressed from one day to the other. It really took years of a lot of times it was parents that were, you know, pretty strict, or just a lot of kind of what the society and the were telling them, and then they grew up and they never really confronted those core beliefs, so they just kind of went about their life just kind of accepting it. And part of a CBT therapist is to look at that, look at the core beliefs, and then work with the client so that modification can be altered. And though that's part of a CBT intervention. Um, so make sure you're familiar with that. The book talked about Socratic dialogue, and what that is engaging with the client in order to see how their beliefs are making sense. For example, if I have, you know, arbitrary inferencing, I'm just kind of selecting things, picking and choosing, then as a therapist, an intervention would be, oh, well, does that really make sense? When you're making these picking and choosing inferences, does that really make sense? Or are you just kind of picking and choosing what you want in order to match up with what you want to believe? So that's kind of the Socrates, how he would engage with individuals, and very philosophical, and that's actually I've actually seen it done, and I would say it's a science, but you have to practice it a lot. You have to really be able to play that so that the client doesn't become overwhelmed. So it's certainly something to almost like an art, in my opinion. Um, the book also mentioned stress inoculation therapy, and that's Dr. Meichenbaum. Um, it's a type of intervention where they do a lot of problem solving, relaxation training, behavior rehearsing, self monitoring. Just be aware of that. That's actually kind of real popular in the hospital settings. So for the community counselors that are looking at um, working in that field, that's something to look into. And finally, CBTs, they have a lot of data. So when a client um, comes to me and I'm a CBT therapist, I'm recording these thoughts. I'm looking at their core beliefs. I'm trying to figure out kind of what their core beliefs are and how that's impacting their behavior. I'm doing a lot of collaboration with other CBT therapists in order to get the best interventions for that client. So some of that triangulation, where I might collaborate with a psychiatrist and with a supervisor in order to figure out the best intervention. So I would do things like thought record. So looking at these automatic negative thoughts, and then explaining it to the client and letting them know, these are happening automatically. Um, let's challenge them. Let's try to modify them. So I think that is it for the cognitive behavioral therapist. Like I said, make sure you know Aaron Beck. Make sure you know kind of the rational, irrational, um, the core beliefs, negative core beliefs. To me, it's a fascinating theory, because it really challenges clients' kind of perception, and it's tough because the client has to be open and willing to do it, and a lot of times you have a lot of resistance with that. So it's certainly, like I mentioned with the other thing, it certainly is an art, but that kind of wraps it up for this chapter. Make sure you're looking at the PowerPoints, reading the textbooks. I know you are working hard, so thank you for that.